Hi everyone, thank you for visiting our page Child Wellness with Dr. Mahmood. I am Dr. Mahmood Said, I'm a pediatrician, and I will be trying through this page to give you some valuable information about child's health and well-being. We will be trying to do this in a very simple way that will be beneficial to the mothers, the new mothers, and the caregivers. We don't intend at all to replace your doctor's visit. Visit your doctor regularly to follow up your child, and visit your doctor whenever you feel that you are worried about your child. We will be posting different posts and different videos speaking about different topics, starting of which we will be speaking today about a very common topic in children, and especially in the summer times, which is gastroenteritis. Gastroenteritis presents with diarrhea 3, 4, 5 times a day, maybe even more, vomiting 4 to 5 times a day, maybe non-stoppable, and fever, which could be a low-grade fever or a high-grade fever depending on the cause. The main danger in gastroenteritis is that your child loses lots of his body fluids and he might be dehydrated. This is where the treatment starts from. This is where the treatment focuses on replacing the lost fluids. First, we try to replace this by the oral route through the child's mouth, and if this fails, we have to do this through an intravenous line in the hospital. We give this replacement therapy in the form of extra fluids and oral rehydration therapy, which is calculated according to a specific dose, according to the child's body weight, and this should be done by a medical professional. If this fails because the child's vomiting, we add on a medicine that stops the vomiting, and then we try again with the oral replacement therapy. Sometimes this also fails and the child keeps vomiting. This is when we have to start giving the child the drug or the medicine that stops the vomiting by an intramuscular injection, and then again start the rehydration oral therapy. Sometimes this also fails, and this is when we have to go to the other option, which is replacing the lost fluids through an intravenous line. This is step number 1 in the therapy, which is replacing the lost fluids. Step number 2 is treating the cause. The cause could be bacterial or viral or other parasites, but in most cases it's a virus. If the cause is a virus, antibiotics aren't needed. Actually, antibiotics can make the diarrhea worse if the cause is a virus. If the cause is a bacteria, antibiotics will be mandatory, and if the cause is other parasites, the treatment is given according to that parasite. The question is, how do I know the causative agent? What is the bug that is causing my child's trouble? This is done through doing a complete blood count, which when interpreted by a doctor, it gives an idea about the causative agent, and also through doing a stool culture analysis, which also shows the causative bug. If the bug is a bacteria, this is when we need the antibiotic, and the antibiotic has to be specific to the causative bacteria. Another question that people might ask about gastroenteritis is, how long does it take for my child to get cured from the gastroenteritis? The answer is, it's variable. It could take as long as 2 weeks, so we have to be patient with our children and with our therapy, and consistent with the therapy. Another common question that we face about gastroenteritis is, when should I get worried? When do I have to worry about my child? What is the red flags? Your red flags are worsening of the condition. The fever is getting higher, the diarrhea is getting worse, vomiting frequency is more, and as we said before, the main issue, the fluid loss, your child's dehydrated status. If you find out that your child is dehydrated, he has his eyes are going deeper inside, his opening fontanelle in the head in the children less than 1 year, it's lower, his skin is like the skin of an old man. You pull it, it doesn't return back to its normal quickly. His urine, he doesn't get urine at all, or his urine is very dark yellow color. This means that the child is having no fluids inside, which means that the child is dehydrated, and this is when we have to seek medical advice immediately. Another common question is asking about the rotavirus. Does the rotavirus vaccine eliminate the probability of having gastroenteritis in children? No, it doesn't. It just reduces the probability, because diarrhea due to rotavirus is common in young children, but it doesn't eliminate it completely, because your child might get diarrhea from another virus or from another bacteria than the rotavirus. I hope that we have covered most of the important topics in gastroenteritis, and I hope that this was simple and easy for you to understand. Thank you again for visiting our page, Child Wellness with Dr. Mahmood, and see you in the next videos. Bye.